How to measure your dental website's ROI. How do we actually measure ROI for your website? I'm Amo from Oral Web Studios, where we help dental practices gain more patients and boost credibility through specialized websites. In this video, I'll explain how we measure ROI for dental websites, what metrics actually matter, and how to think about website performance realistically. What ROI actually means for your dental website. ROI is simple. Is your website helping you generate new patients? And hopefully this is an easy answer for you, right? So a dental website is not a billboard or a brochure, which means it's not that just to display information about the procedures you offer or to display information about your dental practice in general, but it is a tool to help you book patients, right? To help you generate more opportunities so you can book new patients. And yeah, so it's a tool designed to turn visitors' phone calls into booking requests or appointments. A dental website is responsible for what is a dental website responsible for and what it is not responsible for. Your website is responsible for clear messaging, building trust, and making it easy for patients to take the next step. So obviously, if your dental website is confusing, whether it's confusing to navigate through, or it's confusing which action the visitor should take, or the copy on your website is generally confusing, maybe when you're trying to explain your procedures, obviously this confusion is going to make you lose visitors and they won't end up booking, right? So your website should have clear messaging basically and have a clear book to call action. That is what your website is responsible for. It's responsible for building trust, right? It's 2026. Most businesses right now have websites. If your dental practice does not have a website, what are we doing? But obviously, if you're watching this video, then you already have a website, right? Hopefully. So it's there to build trust. Like I said, most businesses basically have a website. And then on top of that, you can display your credentials, right, to boost credibility, to help visitors trust you more. You can display trust badges, right? And you can display your reviews and also before and after procedure images. This also builds trust. Visitors can see there's an actual business, you've had clients, and they can also see your work. This also builds trust with visitors or potential patients, right? So your website's also responsible for making it easy for patients to take the next step, okay? Which is to book an appointment or book a call. This should not be a complicated step when trying to book an appointment, right? They should just click the book appointment button and it may redirect the visitor to your dental software where you will ask them questions, simple questions, name, email, or phone number, and then the day or date when they would like to book the appointment, right? If that's what they are doing, if that's the purpose of your website. So that's what the website is responsible for. It's not responsible for how well front desk answers the phone, right? Or whether a patient shows up or whether treatment is accepted. So your website presents opportunities for your front desk, right? Whether the patient shows up is not the fault of the website. Whether the treatment is accepted is not the fault of the website, right? Your staff presents the treatment, of course, right? So that is what the website is responsible for and what it is not responsible for. Now we have that out of the way. Let's look at how we measure ROI. So step 1, count website generated opportunities. These are actions that only happen because the website exists. The click to book an appointment, click to call the practice, or clicks into your dental software. These are opportunities that your website creates, right? This is the website's direct output. For example, If your website generates 30 bookings, right, or call clicks in a month, that's 30 patient opportunities. That's opportunities that your website created. Okay. Step 2, track how many of those turned into booked appointments, right? How many of those opportunities that are generated by the website turned into booked appointments by your staff. So this part happens inside your practice, not on the website. Check your data, your front desk logs, or practice management software. For example, if your practice books 12 out of the 30 opportunities, your website to appointment conversion is now 40%, right? So your website generated 30 opportunities, booked 12 of those opportunities were booked. That's a appointment conversion of 40%. Step 3, multiply by average patient value. For example, if the average patient is worth $1,200 over time and 12 patients came from the website, that's 14,400 generated, right? Then you compare website cost versus revenue created, which is your ROI. Okay? So obviously these numbers will look different for different practices, as different practices are at different stages, but that is the general way of how you would do it. Why traffic alone is not ROI? Some people might misunderstand this, but high traffic does not equate to high ROI. 1,000 visitors who never call or book are less valuable than 100 visitors who are actively looking for a dentist, right? Because those thousands of visitors, even though it's high traffic, but they don't do anything, they're basically useless, right? Those aren't opportunities created. So what matters more is high intent local traffic more than raw numbers. What do we look at when ROI is low? These are things we look at when your website is not performing. We look at whether the messaging is clear, right? Obviously, if a patient or visitor is confused, they will log off and basically go to the next website, right? Are call to actions easy to find, right? Does the site work well on mobile? As we know, most people search on mobile, so they'll most likely be on your website on their phone, right? And your make sure that your website on mobile works well, right? It's not clunky, it's not slow, anything like that. Is the site fast and trustworthy? Okay, if you have a slow site, some people will basically get off the site very fast and look for a different website, right? And if your website looks old, hasn't been updated, that basically does not look trustworthy, obviously the visitors are going to go off and on to the next website. So small improvements in clarity and usability can have a big impact on your ROI. Just improving these small things, your messaging, whether call to actions are easy to find, all these things, right? Just small improvements on these points over here can boost your ROI. So at Oral Web Studios, we keep ROI measurements simple. We track opportunities the website creates, how clearly patients move through the site, and whether performance improves over time, right? So that is very simple. So thank you for watching this video, and we will see you in the next one.